And then I'm going to have the patient go ahead and turn and look towards me, down your arm. And it's a positive test if the pulse diminishes or disappears. Then that'll be positive for thoracic outlet syndrome. If it stays the same, then that's a negative test for thoracic outlet syndrome. And then you always want to test both sides to see if they're the same or if they show a difference. The next test is going to be, we'll do Sperling's, and that's going to test for any sort of neck pathology where you're looking for a ruptured disc or something pinching a nerve in the neck. And you're basically just going to gently grab the patient's head, tilt it over to the side and slightly backwards to shorten the facet joints, and then put light compression down on the head. A positive test would be a radiculopathy that goes down the left arm. And then if you turn and come to the right side, or the left side, sorry, light compression, a positive test is again if radiculopathy all the way down the arm. If they just have pain in the neck, that's not a positive Sperling's, that just means they have some sort of other neck pain, but it is not positive for radiculopathy. And then we have distraction, and essentially you're just basically lifting the head straight up to see if that relieves their symptoms. If they say, oh, that feels better, then they probably have some sort of neck pathology, pinching the nerves. If it doesn't change their symptoms, it's a negative test. Valsalva, you can ask the patients if you have a syringe to take it and just blow into the small of the syringe, and basically it's just like bearing down. If they have pain with that, you have to ask them where the pain is, and if it's in the neck, that could indicate that they do have a nerve that's being pinched somewhere by the increase in pressure. If they have no pain, it's a negative test. Shoulder abduction, I'll just ask the patient to go ahead and lift their arm and place it over their head. And what that does is it takes the stretch off of the brachial plexus. If that relieves their neck symptoms, then that is a positive test indicating neck pathology. If it doesn't change their symptoms, or if it hurts in the shoulder joint itself, then it's unrelated to the neck and it's more likely a shoulder problem than a neck problem. And we'll move on to thoracic and lumbar. You can relax. And then Valsalva, again, you can do it also for the thoracic and lumbar as well, and you always want to ask them where the pain is when they do the maneuver. And again, if it's pain, it's positive test, no pain, negative test. So straight leg raise, I'll have the patient have a seat. 2 ways to test for straight leg raise. Oh, have a seat first. There you go. So he's having a seat. I'm basically just going to grab his leg, lift it up to where the knee is straight, and ask them if they have pain. If the pain radiates down the sciatic nerve all the way to the foot, that's a positive test. If they say, oh, it just feels tight, it hurts in the back of my knee, that's not a positive test, but you can note it on exam that they have pain and tightness in the back of their leg to the knee. But a positive test would be that it'd have to radiate all the way down to the foot. And again, you always do both sides and just compare. Have them go ahead and lie down. You can do the same test the other direction, the other way, lying down. And again, you just grab their leg, tell the patient to relax, lift it up as far as they feel comfortable, and just ask them if the pain radiates all the way to the foot. That's positive. If it doesn't, it's a negative test. And you always compare both sides, looking to see if one side is more flexible than the other. And that's one of the Waddell signs as well. If they have positive pain when you do it here, when they're lying down, if they say, ow, ow, that hurts, it radiates down to my foot, but then you've already done it with them sitting and they had no pain, that would be a positive Waddell sign that they're maybe making up their symptoms. So Patrick Faber's is basically where you ask the patient to cross their leg over, and it's basically just their ankle is going to fit just above the kneecap on the other side. And then you're basically going to apply light pressure on the knee here and on the pelvic bone on this side. And as you press down, you ask the patient if they have any pain. If the pain is located in the middle of the back, that's positive for back pathology. If it hurts in the groin, that's more related to the hip. So it's kind of to help differentiate between back pain or hip pain. And again, you always do it on both sides, of course. And you're again comparing also their range of motion too of their hip. If one ends up higher, they may have more hip problems than back problems. So again, Patrick Faber, light pressure. You don't have to push real hard. This is not a very comfortable position for the patient. Just light pressure. So that's Patrick Faber. Pelvic rock. You're basically just going to take your hands on either side of the pelvis, and you're just trying to squish the pelvis together. And what that does is that spreads open the SI joints in the back, and you ask them if they have pain, and again, you ask them where the pain is. Is it in the back, or is it where you're pressing? Because maybe they have a pelvic fracture or a bruise or something else where you're pressing, and it's not actually related to the back itself. Babinski. You'll want to get like the end of a hammer, a DVT hammer, and you can't see on video, but basically you start from the middle part of the heel and kind of make a circle and kind of come up like that. And he's sort of fanning out, I don't know why, but but basically a positive test, I guess, would be if he actually did fan, he would have some sort of upper neuron issue. But typically most people will flex down to that response of doing that guy. So that's Babinski's. Oh, he just did it there. That's good. Very good. And then Trendelenburg, or first of all, we'll hear another Waddell test. Is you're going to grab both underneath both heels, and you ask the patient to go ahead and raise your left leg for me. And while he does that, you should be feeling on the left side to see if they push down. If they push down, that's a negative test. If they don't put pressure on this hand, that is a positive Waddell sign, and you have to wonder if they're really telling you the truth about what's going on with their symptoms. Strawberries, lower legs, burns. Okay, and then let me have you stand up for me, carefully, no falling. Go ahead and face the pool, and then you're just going to fold their shirt up a little bit so you can get a good view of where their iliac crests are. It's right there, and then you're just going to ask him to go ahead and stand on your left leg for me. And again, you're going to be watching the pelvis to make sure that this doesn't dip down. If he dips down, that's a positive Trendelenburg test where you have weakness of the left abductor muscles. And then you have patient stand again for me. And this time I want you to stand on your right leg. Perfect. And again, you're watching the level of the hips. If this dips down, that'd be a positive right abductor weakness. And that, I think, pretty much covers